So salary negotiations between public sector unions and government have deadlocked. Labour has confirmed the deadlock after government stuck to its position that it cannot afford to raise remuneration during talks held late into Friday. Now, COSATU-affiliated unions say they'll only go back to the discussions when the state presents a revised offer. Nurses Union Denosa is among those unimpressed with government's position. Its second Deputy President, Thandeka Msibi, will join us now by Zoom to talk more about the negotiations. Thandeka, very good evening to you. Thank you so much for your time. So, government was on Thursday already saying that its bank balance is in a desperate state and a freeze on wages at this point is its best option. What makes you think that you'll get any kind of revised offer based on the union's declaration of a deadlock today?
Yeah, thanks, Thembekile, and thank you for giving us this opportunity to talk to your viewers. It is a sad moment in this democratic country that even this year we have to talk of the employer that is reluctant to pay the increase, the salary increase of the public servants. Thembekile, we are really disappointed by the Minister of DPSA, Minister Senzo Mchunu, because as you are saying, the Minister took the negotiations out of the chambers to the platform of the media. That is why we are saying on Thursday, the minister already was saying they are not going to move. That is very irritating and provoking.
But irritating as it is,
the minister can keep the discussions inside the chambers so that we are able to understand what is it that they want to table to us. Unfortunately, the public servants has to face an uncaring employer who doesn't value the contributions of the public servants into the public services. Okay. That is very unfortunate.
I want to come in there, Thandeka, because the minister himself was saying at that briefing on Thursday, and it wasn't a new position, this was said, I think, even last year, that government could not afford to pay any kind of increase. That's why you're currently in court as public sector unions fighting government for reneging on the 2018 agreement. And as things stand, it looks very unlikely that you will get a revised offer. So why not just declare a strike then?
We believe in negotiations. We respect the collective bargaining. We believe that if the employer, which is the state in this instance, has problems, they have to table those problems at the table of the negotiations. It's very unfortunate that the current government has decided to go out and negotiate with our members and irritate them more. So we don't know. Where we are, we think that the members have already spoken in the social media. They've already responded to the Minister of DPSA from the social media because he's engaging them. He's engaging them directly. And what is going to happen is that the minister will just dish out the pot that he has been cooking.
Here's the other problem,
we were open to negotiations and we wanted to settle inside the chambers. But because now he has gone out to declare a war and also to launch a strike, we are not launching the strike. He is launching the strike for the public service.
So here's the thing, Thandeka, pardon me for jumping in. We don't have a lot of time, so please allow me to jump in here. The issue here is public servants. A lot of South Africans are sympathetic and also quite grateful based on the work done by doctors, nurses and paramedics and police officers during the lockdown, which is among the things you cited as to why your members are deserving of an increase. But many other South Africans will say that in a year when many people have had to take salary cuts, they've also had to endure freezes on increases. Many have been retrenched because their employers can't afford to pay them. You are being unreasonable by demanding increases of between 5% and 7% when everyone essentially around the world has no money to pay increases.
Public servants are community members. Public servants are family members. They are suffering, they are having the pain that is endured by any other citizens of South Africa. We are also having the problem of the hikes in fuel, the hikes in electricity, food prices have gone up, and medical aids also they've gone up. So we are members of the community, and we are breadwinners moreover. And with the job losses that are there, Thembekile, we are feeding even extra family members. So there's nothing that is said that we are not feeling the pain. We agree with the government that our country is having a financial crisis. But why should the public servants bear the brunt?
Because they say there's no money. But the other thing is, even before COVID-19, there was already talk of a bloated public system, right? A public sector that's bloated, too many people. You've already said as unions that you will not accept any form of job cuts. Would increasing people's wages at this point, I wonder, not strengthen the argument for a need to cut the size of the public sector employee base?
Public sector already, it was having a shortage of staff. With the pandemic, with the COVID-19, also we have suffered because you know the numbers of nurses that have passed on during the because of COVID-19. We know the numbers of doctors that we think that the government is not taking us serious. Members, especially the healthcare workers, are starting now to look at the agencies that they can hire them outside the country. The history is going to repeat itself. Before 2007, we know how workers, especially the healthcare workers, were moving out of the country. We are going to see it down. We are talking to our members, but their patience has been eroded. They want to go out of the country now, and they are applying with this shortage that we are having.
And because they're essential service workers, the reality is police officers and nurses and paramedics, for example, cannot go on a full-on strike because the law doesn't allow that. So what can you actually do? How much can you do to pile pressure on government as far as labour action?
It's not the law. It's not the law that prevents them. It's the reluctance of the employer to conclude the negotiations around the minimum service level agreement. Strike is a right of the trade union, and it's the right of the members. So it's not the law. If they wanted to conclude the minimum service level agreement, we wouldn't be having this discussion that we are raising now.
But as things stand, of course, nurses and doctors and paramedics cannot go on strike, and police officers.
We'll see about that when we get into the discussion around the minimum service level agreement.
Thandeka Msibi, Denosa's second deputy president. Good to speak to you, ma'am. Thank you.